Patients with a complex dissociative disorder are at significant risk of being destabilized and maybe even decompensate when they are exposed prematurely to traumatic memories. The vast majority of these patients require a significant period of stabilization and skills building before they can successfully tolerate and integrate traumatic memories. In fact, the general clinical consensus for the treatment of chronically traumatized individuals, including patients with DID or DDNOS, is a phase-oriented individual outpatient therapy consisting of the following. 1. Stabilization, symptom reduction, and skills training. 2. Treatment of traumatic memories. And 3. Personality integration and rehabilitation. The treatment guidelines for DID and DDNOS and other publications by experts in the field provide an excellent overview of treatment approaches. These publications also provide specific interventions. Nevertheless, therapists are still left to cull a hodgepodge of specific Phase 1 skills-based techniques from the literature and rich oral traditions of the field of dissociative disorders, leaving any given treatment at the mercy of the therapist's creativity and familiarity with the literature. In this manual, we have attempted to gather fundamental Phase 1 stabilization techniques for patients and their therapists, specifically tailored to address the dissociation that underlies and maintains many of their symptoms. Some of these skills include mentalization, mindfulness, emotion and impulse regulation, inner empathy, communication and cooperation, development of inner safety, and cognitive, affective, and relational skills. At the heart of the manual is approximately 30 years of clinical experience that each of the authors has had with patients who have DID or DDNOS, coupled with the magnificent and foundational work of many other colleagues who are pioneers in the field. It is well known that clinical innovations come from clinicians, not researchers, and until sufficient randomized controlled studies have been conducted on treatment of complex dissociative disorders, we are reliant upon this hard-won clinical wisdom. For the first time, this manual provides an operationalized treatment protocol that is subject to empirical validation for this most in need population, which has been excluded from other studies on trauma treatments. Development of Skills Training Manual. This manual is partly based on ongoing learning experiences with outpatient day treatment programs for patients with DID in the past decade in the Netherlands. These day programs usually ran daily during the week for a half to a full day, and they included adjunctive therapies such as art and movement therapy. This distinguished them from the more cognitively oriented courses for borderline personality disorder. The nonverbal experiential components of these treatment programs proved to be particularly destabilizing for many patients with complex dissociative disorders in the early stages of treatment. These modalities can reactivate traumatic memories and dissociative parts, which results in disorganization of the person as a whole, especially when the phobia of inner experience remains intense. These difficulties led one of us, SB, to develop a manualized course of limited duration, comparable to skills training such as dialectical behavior therapy and STEPS, but specifically designed for patients with complex dissociative disorders. An empirically validated Dutch stabilization course for patients with complex PTSD, developed by Etty Dorpal, Coleen Thomas, and Narrator, was the most important published source of inspiration for coping with trauma-related dissociation. As part of a research study, one of the authors, SB, conducted in 2005 a group for complex PTSD patients with an earlier unpublished version of this Dutch manual, Vulgar and Verder, and was greatly impressed with the results. However, patients with a complex dissociative disorder, DID and DDNOS subtype 1, were excluded, which further galvanized efforts to produce a manual specific for dissociative disorders. A positive experience with the complex PTSD group was the impetus for the first author, SB, to develop a manual for patients with a complex dissociative disorder. This manual has a comparable format to and overlap in some themes in Vulgar and Verder, and the STEPS manual for emotion regulation in borderline personality disorder. It also has some similarities with other